Nice to see ya.
Hey, good afternoon, everybody.
Perfect. All right. We'll probably wait another 2 minutes or so. Is that okay before we get started? Perfect. All right, we'll take one more minute or so. We'll get started at 4:04 here, okay? Again, if you're in, you'll need to turn your cameras on if you plan on staying in the meeting. Otherwise, you will get kicked out of the meeting if your camera stays off. All right, let's go ahead and get started, everybody. Welcome, everyone. My name is Dr. Angelita Britt Spouse. I go by Dr. Spouse. I am a public health professor here at the University of Indianapolis, and I teach in both our undergraduate public health and graduate level MPH, so I'm Master Public Health Program as well. I'm also the advisor for Eta Sigma Gamma ESG, which is our public health organization on campus. And we overall focus on finding ways to provide education and service opportunities for students that basically can provide health promotion, health education, and can address health disparities here in the UND community and the surrounding areas here in Indianapolis. So we've been putting on several events so far this semester, thanks to our two Eta Sigma Gamma ESG event planners. The chairs for those, Zanaya Banks, who you all probably got an email from for this event, and then Bronwyn Gitz is also our other co-chair as well. So we are going to get started today. We are having a very interesting topic today that I think is really important and essential that I don't think that we focus on or discuss a lot. So we will basically start off with an introduction, a overall idea of kind of what we're going to talk about. We've already have some pre-planned questions that we're going to ask each of our panelists. And they will address those questions. You all can also feel free to jump in and ask questions throughout as well. This event will mostly be held by Zanaya Banks, who I will pass this off to in a moment. But before I do so, I do want to remind everyone that this event does count for LP credit on campus here at the University of Indianapolis. So you will need to have your cameras on at all times throughout the time that you are joining us here for this panelist discussion. We do have Ian Poston on this meeting as well with us, who also, if you have any questions, you all can feel free to reach out to him regarding LP credit or anything of that sort. So you may get kicked out if your camera goes off. If you want credit for LP, you need to stay on the entire time. But otherwise, I hope you all enjoy this discussion and that it sparks some interesting, thought-provoking ideas. I will pass this off to Denaya Banks to go ahead and get us started.
Thank you for that. Like Spell said, we're going to have an interesting discussion today about minority health. I think it's important to let you guys know exactly what we mean by minority health. Some of the topics that we'll discuss will hit on
Z, you're muted.
Yeah, it got really loud. But some of the topics that we'll hit on will focus on minority population. So by that we mean it could be Black communities, immigrants, Asian Americans, things of that sort. And then so I'll go ahead and start with the panel introductions for today. Vincent, if you could go first with just your name, your organization, and your career title.
Yes, my name is Vincent Hill. I work for a nonprofit organization called Health by Design, and my title is REACH Active Living Coordinator.
Anya, if you could go next.
Yeah, thank you. Hi, everybody. My name is Anya Carson. I work at the IUPUI School of Public Health, and my title is an ECHO Program Coordinator.
Thank you. And lastly, Amy.
Hi, everyone. My name is Amy Shackelford. I work at the Immigrant Welcome Center in Indianapolis, and my title is Program Director.
Great. Thank you all for being here. We also have two speakers who may join later, Hannah Joy and James Garrett. So we'll just be on the lookout for them. If they come in, they'll add to the discussion today. I'm going to start with a little let's talk about minority health Kahoot game here. This is just to give another introduction into exactly what is meant by minority health and everything that is within it. So it's just a little true or false game here. Everybody, either you have the app or kahoot.it. Can go on here in just a second. As soon as this game pin is up, you'll just enter that. Okay, is there anybody that still hasn't been able to join? Okay, we're going to go ahead and get started then.
I wasn't able to get on the Zoom thing or the Kahoot game right away.
You can join at any time if you just put in the code at the bottom right.
Okay, so most of us got that one right. So it seems like we're pretty familiar with the idea of minority populations having a poorer access to care than non-minorities. Go to the next question. All right. So again, we got most of us got this right. So I would assume that we are familiar with minority populations suffering from poor health outcomes more than non-minorities based off these results. All right, you guys are doing good. So this one, I kind of hinted at it earlier. In general, minorities have poor access to care in all areas of healthcare, not just mental health services. But good job on this one. Okay, again, you guys are rolling through these pretty easily. This goes so mortality rates, maybe not poor health outcomes exactly, but again, minority populations do suffer the most from that. Okay, who is Shining Tiger?
That's me.
That's you, Emma?
Yeah.
Okay, go. Okay, so we're a little more differed on this one. As far as this one, you may have had to know like a little bit about minority health history, especially for this question as it relates to African Americans. So you can draw on maybe the Tuskegee experiment that occurred with, I believe it was syphilis. Um, so that kind of set up a little bit of distrust with African Americans and medical professionals. And then if you stay with current events, you'll see articles where Black women feel as though they are not treated as well as other racial counterparts by medical professionals and so on. Right, so good job on this one. And I think it's important to note with this one that since the Affordable Care Act, that health insurance coverage for the African American population has increased as a result. So getting better, but more white Americans still do have the health insurance coverage when compared to African Americans. Right, so that one was true. Hopefully we can hit on this kind of topic later on, especially with Amy here on the panel discussion. Right, good job on this one. So if you kind of think back to the previous question before this and the fact that some immigrants live in fear because of their immigration status, that could be one factor that does contribute to them being considered a vulnerable population here in the US. All right, so really good job on this one. Stigma is actually a factor that greatly affects minority health. It affects how they are treated by medical professionals, affects access to care, and a number of other things. All right, so earlier when I kind of discussed how African Americans' health insurance coverage rates went up after the Affordable Care Act, it's kind of the same for this one. So you should have put true. Minority populations have had greater health insurance coverage and therefore access since the Affordable Care Act. And then you guys can just see here how we ranked as far as that. I don't have any prizes for you, so just thanks for playing, and you'll get LP credit for this event. All right, and then now it's time to go ahead and we'll get started with the panel discussion here. Give me 1 second to pull up the questions. I still hear the Kahoot thing. All right, here we are. For the panel discussion, I don't have an order as far as panelists goes for answering questions. Just chime in however you feel and don't feel pressured for each panelist to answer the question, but it would be nice. So the first question, describe what minority populations you work with, areas of minority health you work in within that population, and explain why it is important.
I guess I can go first. So the minority population that I work with is really geared toward the African American community. As far as the areas of health, I work more on the policy systems and environmental side of public health. So just really developing partnerships and communicating across sectors, a lot of meetings to discuss the issues at hand in the community and relaying that information to upstream stakeholders like the city of Indianapolis. We work with them to try to prioritize what needs to be done infrastructure-wise for the community or just anything to enhance the community at large. So.
Thank you.
Mm-hmm.
I can go next. So I work at an interesting level because I don't work with the community at all. I work with their health providers. And so it's really challenging, but what my program's goal is to educate providers across the health spectrum about such disparities. So that way in their community, they could be doing better work to target and make sure that minority populations have compassionate health care. And so I do work in specific health condition fields. One of the programs is cancer, And for example, African Americans face a bigger burden than the majority population. So what that looks like is that we'll try and bring content to the health providers around how does it look from the African American perspective. And then I also work in the realm of HIV. And so we also know that African Americans continue to face a severe burden of HIV compared to other racial and ethnic groups. And what that looks like is the same for cancer. We try and bring content, so education and resources to these health providers so they know how to provide care for such groups. And then, I just started a COVID-19 program. And so I don't know if you've been hearing on the news about African Americans, minorities at higher rates for getting COVID or just not able to access testing. So that's another thing. And along the same lines, I'm trying to find experts in that realm who can speak to other providers about how we can work on addressing those rates.
Great, thank you, Anya. Amy?
Thank you. Sorry, having trouble unmuting. So the Immigrant Welcome Center, our focus is specifically immigrants and folks with refugee backgrounds. We typically will, serve anybody, but that's mostly who we focus on, or, second generation folks as well. And so we do this by connecting people with the resources and services that they need. And so as COVID-19, when it started, it became clear that we needed to make sure that we had a strong health focus, especially because we do have quite a few staff with health credentials and backgrounds. And so we have a lot of programming from, connecting folks with services and resources that they need, doing advocacy work, doing trainings for organizations on, understanding bias and navigating working cross-culturally. But when it comes to health specifically, we're really working to make sure that there is a wide understanding in the city of Indianapolis amongst service providers around how to be providing assistance to immigrants and folks with refugee backgrounds in a way that is equitable and meets people where they're at. So for example, we're doing a lot of work around language access and the importance of service providers either having a language line or hiring more representative staff so that they can accommodate people in different languages. We're doing a lot of work around the importance of services not requiring social security numbers or documentations, because, which I think this panel is going to be so fascinating and important, is because when we're looking at health and we're looking at COVID-19, we have to look holistically at how it's impacting people. And so for our client base, about half of the folks that we work with are undocumented, yet are also essential workers. And so they are in factories on the production line, keeping the economy going. And so not only are they at higher risk of contracting COVID, but also, needing rental assistance, food assistance, needing to help understanding the healthcare system, sometimes legal representation. And so, we're working to make sure that all of the services that folks need are accessible and equitable. And I think COVID-19 has, really brought a more narrow focus in on that than ever before for us.
Great, thank you. We're gonna go ahead and move on to the second question here. Just asking if you guys could give us at least 2 examples of programs or initiatives that your organization engages in order to impact minority health outcomes, and then briefly explain within that why that is a focus area for you and your organization, and then what you believe the issues or health concerns are that we would see if we did not address these issues through your programs and initiatives.
Yeah, so I can start. Two programs that we're working on right now. The first of which is our walkability and pedestrian safety project, where we have partnerships with different community organizations. For my area specifically, it's the northeast side of Indianapolis, the near northeast side, the Avondale Meadows and the Brightwood Martindale communities. I've developed a partnership with the Martindale Brightwood Library branch. It's a brand new facility at 25th and Sherman. And the other community hub that we have is the Alliance for Northeast Unification, and they're a staple in the Avondale Meadows area. So we've just been trying to work with them. We have champions in their organizations that help us, kind of push the work out to the community, do community engagement sessions to gather input from the community, so that they can voice their concerns to us, so that we can take note and present that information to our partner at the city of Indianapolis, which is the Department of Public Works. They have a team of engineers, city planners, who actually plan to implement different strategies to enhance the built environment, whether that be just sidewalks, crosswalks, intersection improvements, things like that to decrease the rate of pedestrian crashes in the area. So that area is one of our focus areas because has a high crash rate. So that's one area. We have a few areas out west that we're focused on as well, but my work is really tailored on that near northeast side. And the second question, what do I believe are the issues and health concerns? It would be the pedestrian crashes. So the more that we fix those things in the community, the less pedestrian crashes we will see, which will ultimately improve the health of the community. So.
Thank you. Anya or Amy?
I can jump in. So I know I talked about HIV and cancer, but we do also have an LGBTQ focused echo. And so that addresses sexual minorities and how providers interact with them. And again, for this population, you see that they're increased risk for mental illness, suicidality, violence and victimization, and substance use disorder. So this program is going on its third year, and some of the things we teach the providers is how to create a welcoming environment in their office and not use stigmatizing language for their patients, because that can mean a lot if you keep misgendering someone and they need to come and see you about something serious. They won't come see you anymore, and then their health declines because of that. Something so simple that we could try and change can really impact someone's health. Let me see, look at the questions. Why is it a focus area? Again, people's health is declining because of this. And I've seen in these programs, we talk about homelessness. There's tons of homelessness and violence among transgender populations. To me, it's very, very sad. And so we just don't want things like that to happen. No one really deserves that, just based off their gender. Oh, and then I guess I kind of answered, what do I believe issues are with health concerns? So I hope I answered that okay.
Yeah, I think you got it. Amy, anything to add to this one?
Sure, yeah. So we have quite a few programs, but I think the two that we're most focused on right now, because for us, COVID-19 is our priority. Our first is called Project CARE, which stands for COVID-19 Access and Racial Equity. And we launched this program because the statistics coming out of the Marion County Public Health Department, which were not surprising, because that's the reality of our system and our country and our healthcare systems. But the reality is that, the Latinx community is contracting COVID at 4 times the rate of white folks. the Black community, including Black immigrants, at 3 times the rate, and the Asian community at 2 times the rate. And in each of those groups, women are twice as likely to contract COVID-19. And so we launched, first, we started with Project Care, where we created different toolkits that have infographics and videos and information about COVID-19, prevention and resources in 10 different languages that we then are sharing with partner organizations. And we're using as an advocacy tool also to talk to policymakers, because one of the big issues is that so much of the critical information about COVID-19 and prevention is not getting out there to the communities who really need it. And a lot of that is related to language access, and other parts of that are related to folks, not having documentation, not seeking out healthcare, anyways, and not knowing what the resources are and what their rights are as people in the US and as workers in the US. And then the other program is, from our Project Care, we started doing webinars and different workshops and conversations, specifically about racial equity and healthcare. And that led the city to giving us a grant to hire 9 of our natural helper volunteers. And those are volunteers who are immigrants themselves and have different language capability and are leaders in their community. And so we were able to hire 9 of them, and they are now doing outreach and education in their communities, very grassroots, in their own languages, and they're focusing on COVID-19, healthcare access, and also the flu vaccination, because there is a lot of myths and such out there about the flu vaccination. And if you historically have been a part of a group that the government is systematically not just oppressing, but using your body for research and for experiments, then you're probably a bit skeptical about voluntarily getting a vaccine. And what we just saw with women on being incarcerated at the border, and it becoming public that forced hysterectomies are happening on a lot of these women, and they're Latinx women, they're women from Mexico and Guatemala. That just upholds people's hesitancy to seek out the flu vaccination, but could potentially put them at higher risk with COVID-19. So we're trying to, use that program to allow folks to have conversations in their native language with people who they identify with and who represent them, to understand ways to protect themselves and protect their families as we move into winter and the flu season.
Can I add to my answer? Because I think I only talked about one program. Amy, that was great. And I want to tie in some of the things you said to question number 3. But before then, another program or project that my department took initiative in was the 1619 project. And 1619 was a year that the first ship of slaves came over to America. And what this sort of looks like, it was a week of initiatives to make people's understanding increase about slavery in America and what this country was built on and how it impacts the Black community. And I would love to share this play. An IUPUI study was done about discrimination among African American women in Indiana. And I mean, from things you don't even think about, from going to the store, being looked at by, the clerks, from going to the doctor and they, ask you a weird or awkward question. It's just an awkward setting, from being in traffic. It's just a lot of things that you didn't think about. And so in the chat, I put sort of an article from IUPUI where you can read more about it, but I encourage everyone to look into that. And then Zanaya, do you want me? I can answer 3 first to shake things up.
Yeah.
So Vincent doesn't have to go.
Yeah, you guys can read. I'll go ahead and let you just answer that one there.
All right. So the question is basically asking, what do I believe is the most important aspect of minority health? And it ties into what Amy and Vincent were saying. And I think a common trend was access and equity. And to me, that plays a large role in minority health. Do they know about resources and testing centers around COVID? Do they know doctors in their area? Do they know about services in their area that can get are low cost that are free? Lots of times people don't know that. And so I love to be a part of any initiative to increase understanding, but then also make linkage to how to get them there. Okay, being quiet.
Thank you.
Absolutely. If I could double back to, I mentioned in my last question that I would name two programs, and I forgot the other one, but it's actually the REACH program, and the acronym REACH stands for Racial and Ethnic Approaches to Community Health, and that's the grant that I'm working on overall. And REACH is a national program prevention. It's operated through the Marion County Public Health Department. And, it has different domains: a healthy food access part of it, a community clinical linkage is part of it, and the built environment part of it as well. And my work is more focused on that built environment work, which I explained in my last question, but I can go into this question here. What do I believe is the most important aspect of minority health? To me, it's really addressing the high rate of preventable illnesses that exist within minority populations. We often see a lot of diseases and health disparities that are caused by lifestyle behavior change or lifestyle behaviors that can be changed, including the eating habits, exercise habits, smoking habits, just different health behaviors that can be altered, which, over time lead to destruction of the body and lead to these health disparities. So if there's one thing I could change, it would be that. I'd say that's about it for me.
Right. I think that's really interesting. It kind of changed my perspective on how I would have answered that question. That's really important for me, the way that you said it, because those are things that we can prevent. So I know things do exist that we can't. So it'd be really important to just focus on those things that we can have power over.
Absolutely. I know that.
Oh, sorry.
No, I was going to say, I know that there's another side of it too. The inequities that influence access to healthy food and access to all of these things that kind of contribute to why people, have these behaviors. So it's kind of two-sided. It's not only a person's behavior, but like you said, there are other environmental factors that kind of can control or influence one's behavior. So, we need to look at it from both sides. Absolutely.
Thank you. Amy, anything for that one?
Yeah, I completely agree. And I think for me, I will focus on, the systemic and the bigger things, or the like macro level factors rather than the individual, because it is something that I, as a white person, can do something about. And I see a lot of white folks on here. And so, when I first read this question preparing for today, and question number 5, my mind just thought, of course, it's white supremacy and capitalism, and that is, causing so many of the policy issues, the issues that contribute to people not being paid a living wage, not being given benefits at their job. If we're talking about immigrants and folks with refugee backgrounds, folks that are undocumented, there's an estimated 96,000 undocumented folks in Indiana, and studies believe that at least 60% of them have been here in Indiana over 10 years. And so those are folks who have been working, raising families, part of the community, but are still not being, given the same access and rights that I am as a white person who was born here. And I mean, it's just abhorrent that people are not, not able to get a driver's license, or, are not able to get health insurance, and have to really navigate the public assistance system, which we know is very flawed, and forces people to jump through a lot of hoops, even though they are paying taxes, and they are paying a lot of taxes. And so for me, when I look at this, I think, really white people, like we need to do better. We need to challenge each other. We need to be talking to policymakers. We need to be challenging ourselves, and we need to be willing to give something up and sacrifice some of our privilege so that we can create a community that is more equitable, where people are able to access the healthcare they need, but also live the lives that are, their right to live, and, have benefits and be paid properly, and, all of the, pay in-state tuition if they grew up in Indiana and are undocumented and want to go to university. I mean, there's so many things we can be doing on a local level, especially when it comes to immigration, if that's like my focus in my conversation with you all. So I think, yeah, I, as a white person, don't look at individuals and think, oh, you need to be, practicing a healthier lifestyle. That's not my place. My place is, challenging white supremacy and challenging myself, and how I'm a part of that system every day.
Very interesting, Amy. Thanks for that. We'll move on to the fourth question now. Can you describe the health trajectory of the minority population that you've worked with based on your efforts from you or your organization? With that, how far have we come in that area, and where do you see us going?
So for me, not much has been measured or evaluated just yet for the REACH program. But I'll say that our Healthy Food Access program and our Community Clinical Linkages program for Black mothers who initiate and sustain breastfeeding, those programs have improved significantly more than the other aspects of the program, primarily because of the direct contact that those types of programming have with the community. Like my work, for example, was more PSC, policy systems and environmental changes. A lot of meetings are held, and we plan for more long-term changes. So I'll say that those two programs have been doing well, and they've been growing over the months. So.
I would like to relate this question to like a personal effort. So I was recently pregnant, and for those who don't know, Indiana's maternal mortality rate is trash. Like, I was trying to look up the current statistic, but we ranked 48th in the nation, and that's horrible. Like, moms should not die at that rate, especially Black moms. And it's because of maybe distrust in the healthcare system or access to resources. And I think within the last year, we may have ranked 47, yay, or 46. So we're getting somewhere, but I have seen an increased hype about doulas, and especially doulas of color. And doulas is basically like a pregnancy partner, y'all. It's someone that you can talk to about issues that you're having with your pregnancy, or even like resources around pregnancy and the family dynamic. If you're having trouble like with the job, income, needs for your baby, this doula is supposed to be a person that could link you to resources. And so I'm seeing that. I hope that I continue to see people get their doula certification, especially doulas of color, and help these moms out, because that's such a precious moment in a woman's life, that like you should not have to worry about, oh, am I going to die if I give birth, or is my baby going to die because we don't have access to resources. So that's my answer.
Thank you. Amy, do you have anything to add on to that one?
we don't have a lot of great statistics on health outcomes with immigrant communities because undocumented folks are excluded or don't participate in a lot of those types of surveys and research. But I will say what I've seen in Indianapolis since we've started having these conversations, we have been getting so many calls from service providers. I meet with the Marion County Public Health Department every other week, and it seems like a lot of agencies and institutions are becoming more curious and interested in understanding how to accommodate immigrants and folks with refugee backgrounds, which of course, makes me feel like what's been happening the past, however many decades, that I feel like a lot of groups have maybe been really ignored here. But people have been contacting us wanting to get their own language line, wanting to hire our natural helper volunteers to work for them and do interpretation with them or things of that nature. So I feel like we have to be hopeful and positive that as these conversations continue, as we continue speaking up and highlighting the barriers and the factors that cause these things, that more folks will get access, more folks will be treated fairly and equitably when they are seeking healthcare, and that will have positive effects on their health in the long term. One example is there's an organization who focuses on the health of women, and historically we heard that they'd been turning people away who didn't have social security numbers. And so we set up a meeting with them to ask about that. And it turned out they didn't even need social security numbers for the service they were providing and for the grants they were reporting on. And so they took that off their application. And so I think we just need to keep having these conversations and challenging folks to, totally recreate and co-create how they are administering services and doing intakes and things of that nature. So I think there's a lot of hope, and I think we have to stay positive that we can keep changing the needle and shifting it.
All right, thank you for that. We only have 10 minutes left for this event. I think that all of you guys kind of hit on barriers that come up in your organization when you're trying to improve minority health. So we're going to kind of skip past 5 just for time purposes. I really want to be able to hit on number 7 just so that the students can leave with something on their minds. So for number 6, how have minority health movements, if you think about Black Lives Matter or like the civil rights movement, how have those affected minority health? And how have policies or social norms and the current culture today impacted minority health?
That's such a heavy question because we are, doing the presidential election, and then also the Black Lives Matter and civil rights. So it's so heavy. Just speaking on like my circle in my community, it's a heavy topic, and I know people who can't even focus on work or what's going on around them because this issue of minorities dying at the hands of police officers is frustrating them. And like, what do we do about it? What can we do about it? Um, that's tough to answer. All I can say that it's heavy and it's causing a lot of stress and discomfort because we just want something changed. We want it changed now. And I mean, how old is the United States and what has changed over time? We're now seeing that, what is it? Racism is a public health issue. It's 2020. How long does it take to see that? Like that, I'm gonna mute myself while I gather some other thoughts. If Vincent and Amy, you wanna chime in.
I think one thing that I like, especially like to hear from you all, is if you feel like the current movements that we've been seeing have maybe brought more light onto some of these instances. I can definitely concur to everything you said, working in the field I work in with health disparities. I also just think that the current movements have also brought more light on those huge gaps of health outcomes that we're seeing in even the immigrant population, even with the current policies where we're having these immigrant, if you ask me, like camps, like almost like a Holocaust type of thing, keeping, children in cages. It really, in my opinion, made us start to care about, wow, like what's really happening with these groups. So do you all feel that these movements have maybe begun to bring more light to the importance for those things that maybe people have not seen before in general? I know that these movements are coming out of a lot of frustration that we're starting to see building up, and we're starting to speak out more, but also do you feel like it's just helped in all your calls? Like, yes, now we see it's a problem. Come in these the ways that you can.
I'll just speak for my experience in my organization, which I will say nonprofit organizations have a long way to go. And if you know me or have seen me talk before, you know that I will be very honest and critical about the nonprofit industrial complex. But I will say what I've seen in my organization because of the Black Lives Matter protest over the summer. And I think having in Indianapolis was critical, like to have such a massive outpouring of people in support, because Black Lives Matter has been active and public for over 10 years now. But having what we saw, happening in downtown, I think made it so that the white progressives who work in a lot of these leadership positions actually had to talk about it, and they don't want to, right? Like they're very comfortable in their privilege. And so at my organization at the time, we did have a white person in our leadership, and it was really, really tough because she did not want to acknowledge that immigrants experienced racism. And we were, as a staff, because my staff is incredibly representative of the community that we serve. And so we as a staff had to really organize ourselves and come together with the same demands and the same talking points that, we cannot talk about immigrants and completely exclude Black immigrants, one. And for two, act that, brown and Black immigrants aren't experiencing racism in the United States. I mean, it's totally ridiculous. And so we had to work to organize our leadership to get them to understand what is actually happening, and that Black Lives Matter is our issue. Because she kept telling us it's not in our lane, stay in our lane. It is in our lane. It is in all of our lanes. And so for us, Black Lives Matter has pushed us forward to a point where now as a staff, we are able to be publicly in forums like this, talking about white supremacy, talking about how it impacts the community and the people we work with. And, we're finally starting the journey to become a very intentional anti-racist organization. And I think that is what we're seeing happening at a lot of institutions in Indianapolis, because I think the leadership can't hide anymore. And Black Lives Matter has given a platform and enough rage, honestly, boiling up in enough people that, it's not good enough. And we're gonna want more. And Black Lives Matter gives just like the perfect narrative and talking point to have those conversations that are difficult that folks I don't think would normally be having, at least in Indianapolis from what I've seen. So that's my fiery response.
And yeah, I want to say that I really appreciate you saying that. I also just want to highlight that it's not just racism that immigrants face, but Black immigrants, but most immigrants are facing some form of discrimination and or prejudice that holds them back, that impacts their health. And for those who don't know, when you're experiencing heavy discrimination against you, it provides extra stress, it weighs on your mental health, and as a result can then cause depressive symptoms, will cause you not to want to do things because of that discrimination that people face. They don't want to go and to access care, or they don't want to go, out and about and interact with people because they're afraid they're going to be discriminated against. I love that you said that, and I just want to make sure we're making sure that we understand even outside of racism, they're experiencing discrimination. I don't know if you guys know, but in time of social media, we're seeing so much now where seeing people have these videos where people are saying, speak English because you're in the USA. Well, I just want to be very clear that if the only language you know is English, you're probably behind the curve, because these people who come from other countries, they are usually sufficient in 2 languages. And that actually makes them very highly intelligent. And I think that we have to open our minds to what that means. I love that. If we could go to question 7, that you all could maybe highlight for our students, what can we do and get involved in to improve and impact minority health? I would love if you all could just start or kind of end off with that to give our students something to move forward to do. Vincent, if you want to backtrack to number 6 and you respond, that's also okay, but no big deal. I just really want to leave our students with what can they do moving forward to help improve and impact minority health.
No, absolutely. Can you all hear me? Yeah, I apologize. My connection has been terrible. I'm not too familiar with any specific programs going on right now, but I'm sure that there's a lot to contribute right now. Just given that many people are facing the economic effects of the pandemic, just including food insecurity, eviction rates are going up, unemployment rates right now, et cetera. So I say you can start anywhere, from food drives to COVID testing. COVID testing sites, places like that to volunteer. Those will be some good places to start right now, but I'm not sure if any bigger programs than, just the minor help out things. But just going back to what was just said for the previous question, it kind of ties into my work a little bit, just like this term I became familiar with recently is called arrested mobility. That just kind of speaks to the fear that many African Americans have of being racially profiled when they're out in public spaces. This social issue, it's important to address because, it impacts the well-being of many African American people, when they're unable to go outside for a run outside or, walk to a corner store, ride a bike or, wait at a bus stop without the possibility of being profiled, questioned, or harassed by police or any vigilante. It's a very serious problem, and it's no way to really answer that right now. It's a hard question. Like how do we get around that? So I mean, I welcome any input or any ideas around that, but that just goes to show, like, even when a built environment is already in place, the environment may be accessible, may be walkable, may be bikeable, but still, certain populations may not want to go out and use it, even if it's there. So, what can we do about that? So, I'll leave it there.
Thank you so much. Anya or Amy, do you have anything to add on what the students could do?
Really quick thing, assess where you are in research. I will put a little, that's it for my piece. Assess where you are, research, and speak up if you see something foul. The article I just put in the chat box is about racial bias among medical students and residents, and it's a 4-year-old document. So these are our future doctors.
I love that. Thank you so much, Anya. Amy, do you have anything that you can share?
Yeah, I'll just add that, I think wearing a mask is really but also just, I like to think that we're all just a catalyst of change. So I think the beauty of health and public health is that it is everything all around us all the time. And so, I think working on yourself, understanding and unpacking the issues we're talking about, being uncomfortable, and then, every day there are lots and lots of opportunities to do something or speak up or challenge something that can have a ripple effect. And so just as a student, I know sometimes the power dynamic makes it feel like you don't have, you know, a voice, or you shouldn't speak up. But just, I encourage everyone, find your voice, find your power, and you know, any opportunity you see to say something, challenge someone, do it.
Thank you so much for that, Amy, Anya, and Vincent. Thank you for taking the time to speak with us today. I know we're a little bit over time, but if any student has any burning question that they want to ask before we close up today, now would be the time. Okay.